Pregnancy first trimester complications. The first trimester is the first third of pregnancy, and it lasts roughly 3 months. Most doctors define it as weeks 1 to 12 of pregnancy, but some say that it extends into week 14. Doctors count from the first day trusted source of a person's last menstrual period to determine the stage of a pregnancy. By the time a person misses their period, they are already about 4 weeks pregnant, even though conception occurred only a week or 2 earlier. Therefore, a person typically only knows that they are pregnant for about 2 months of the first trimester. We'll discuss the complications that people may experience in the first trimester. It is very important that during this time, to prevent neural tube defects, that the mother maintains a healthy diet with sufficient amounts of folic acid. The risk of having a miscarriage is highest during the first trimester, and those risks can be minimized by taking prenatal vitamins and avoiding smoking, alcohol, and drugs, including some prescription drugs. Physicians also recommend dietary changes including cutting caffeine, deli meats, and shellfish out of the diet to reduce the chances of a miscarriage. Additionally, smoking and the consumption of drugs and alcohol can cause serious pregnancy complications and birth defects and should be stopped during the pregnancy. Other complications in the first trimester to be aware of include bleeding, hyperemesis gravidarum, which is excessive vomiting, spontaneous abortions/miscarriages, ectopic pregnancies, and molar pregnancies. Bleeding. Minimal bleeding or spotting commonly occurs during the first trimester, but because it's very difficult to determine which cases could cause serious problems, bleeding should be taken seriously unless determined otherwise by your physician. Bleeding can, in certain circumstances, be a symptom of an impending miscarriage. If you experience vaginal bleeding, you should consult with your physician to ensure nothing more serious is going on. Hyperemesis gravidarum, severe vomiting. Vomiting occurs predominantly during the first trimester because of the BHCG hormone. This hormone, known as the pregnancy hormone, stimulates the chemoreceptor trigger zone, CTZ, center in the brain, which stimulates vomiting. If vomiting becomes persistent and severe, it could prevent the mother from getting necessary nutrition and fluids, and if not treated, could put both the mother and baby in danger. If you experience persistent and excessive vomiting, it is very important to see your physician to get the proper treatment. Spontaneous abortion miscarriage. When pregnancy termination is not induced voluntarily prior to viability, it is known as spontaneous abortion. Women who have no prior history of spontaneous abortions are roughly 15% likely to have one, however, the risk rises if they have had them before. Symptoms to be on the lookout for include lower abdominal cramps with a backache, vaginal bleeding or discharge, uterine contractions, and nausea or vomiting. This can be caused by genetics, specifically chromosomal abnormalities, as well as endocrine causes including progesterone hormone deficiencies, uncontrolled diabetes, infection, abnormal placental implantation, and others. Ectopic pregnancy. This occurs when the implantation occurs outside of the uterine cavity, where it is supposed to be. In most cases, implantation rather occurs in the fallopian tube. An ectopic pregnancy is an emergency and must be dealt with quickly. Key signs to look out for are lower abdomen pain on either side, a sudden onset of cramping and possibly fainting, repeated periods of severe abdominal pain, vaginal bleeding, increased urinary frequency with a burning sensation, multiple missed periods, and a fever. If caught early and treated, many ectopic pregnancies can resolve on their own with treatment and/or surgery. Molar pregnancy. A molar pregnancy occurs as a result of an abnormal development of cells in the placenta that cannot support a growing embryo. Molar pregnancies are caused by chromosomal abnormalities in the sperm that fertilizes the egg, or both. The risks of having a molar pregnancy can be increased by becoming pregnant at higher than 40 years of age, have the highest incidence rate, malnourishment, protein deficiencies, and previous occurrences of molar pregnancies. Symptoms to watch for include irregular periods for 3 to 4 months, brown, prune-colored bleeding, and excessive vomiting. The first trimester of pregnancy may feel like an uncertain time, but a strong relationship with a trusted healthcare provider can help ease anxiety. These professionals can help ensure the health of the person and their pregnancy and offer practical strategies for dealing with early pregnancy symptoms.